As a medical student, I actually had rotation in vascular surgery department, and I loved the challenge in the surgeries itself, and I was drawn to that. But then, as a resident in general surgery, kind of getting more experience in that, and kind of encountering the patient at a deeper level, I kind of loved vascular surgery and wanted to be in it because it is a surgical specialty in one hand, but it has that longitudinal relationship with your patients. So they're basically patients that you follow up for the rest of their life. It's not something that you cure and send away. And so it has the combination of what I loved, which is the human connection and the relationship with the patients. And you can basically have all aspect of care with your prevention and risk factor management, and then the longitudinal follow-up and relationship that you build with the patients. But still, it's a surgical specialty where you can do interventions and see the results as well, most of the time immediately. So I love that. I love the complexity of the procedures that we have in vascular surgery, and I love the fact that it's constantly changing and evolving with innovation, and that there is that strong connection with thinking outside of the box and building new technologies and developing new technologies to just keep improving. So all of these things together kind of made me love vascular surgery. My mentors are the ones like had said, usually, your niche kind of chooses you and you don't really choose it. And it happened kind of similar to that is that I had a patient who just delivered a week prior and was transferred to me as a vascular on-call at the medical center with an aortic dissection. And I took care of her, I treated her, and just going into that field and trying to know and learn more about, because it's not something that's common, you don't see a lot, that's aortic dissection related to pregnancy. And as I kind of delved deeper and deeper into it, I realized that it's not just the aortic dissection and pregnancy related that we have lack of knowledge on. It's actually a lot of things related to women in vascular surgery in general. So we'll continue with the same approach. And it is, I have a goal and I'm not going to change my goal based on that surrounding. I'm going to continue to go through my goals. If there are things that I can influence, meaning that I can have discussions, I can educate, I can raise awareness, and kind of mention, hey, some might do that, and if you're at a position to be a role model or someone look up to you, maybe doing this intentionally more, or advocating and being an ally will kind of give inspirations to others to be that. So kind of like getting people who want to be allies and giving them the opportunity and encouraging to be more allies so we can promote people. The fact that we are now more and more interested in this, we're designing trials differently, we're thinking about those questions differently, that in the next decade we might have a little bit more answers to this question as to why it's different. But it's a combination of many things. It's a combination of the biology, and it's combination of the social aspects of things, and it's the combination of the biases that are already within the healthcare system, with the preconceptions about how those diseases behave. Many women present with non-typical symptoms, and so a lot of times they're either misdiagnosed or ignored. I would give this advice to any younger person who's joining medicine. Definitely can focus on either women or any groups who feel that they're underrepresented or feel that they're a minority in a setting, and that can change in different settings, right? First of all, choose something that you're passionate about. Whatever path you choose in medicine is not going to be easy, and it's going to have obstacles in it. And on the difficult days, you're going to have to remind yourself why you chose it. So if it was for the wrong reasons, you're not going to be able to pick up yourself, and you're just going to get burned out, and you're going to get bitter very quickly. If you choose it for passion and love, then remind yourself of that, and then be very strategic of your plans and how do you want to pursue your career. You are learning, so things can develop and evolve. Always build that circle of support around you, whether it's physicians and people in the small community that you chose. So if it's in your department, that's great. And if not, there's a lot of people who can be your support circle, even in different departments, not just working with you. And those are people that you can go for advice, you can ask them for guidance, you can try to reach out to them when you feel things are difficult, and they can help you kind of also build up your strategy and think, how do you want to move on? And even when you're thinking that you chose one way and in midway you thought, you know what, something changed and maybe that's not it, and that's okay. But having that group of people that you build up over years to guide you through it is a powerful tool that I cannot emphasize enough. I would love to feel or think that I've given an example of what it is to be a vascular surgeon that loves the profession, that wants to promote the profession and cares about her patient, about the colleagues, and that always looks for an opportunity to lift up the vascular community, whether it's other colleagues, patients, or the residents that we're training. And so I hope to just set an example of a positive influence in the society as far as building the community and building the specialty. Believe in yourself. If you don't believe you can succeed, no one will. You are your biggest fan, your number one fan, and it's you. And I've had that, said to me by one of my colleagues, and it's true. If you do not believe you can make it, it's very difficult to convince others of that. So first of all, trust in yourself, know what you want, and go for it. Don't be afraid to dream big and follow that dream. And it's okay if we sometimes stumble or fall and we have to stand up and keep going.